Most of these patients, just with that first 10 pounds, the pseudotumor symptoms improve drastically and they get lifelong control. So what do we do in a patient who we feel has pseudotumor cerebri? They either have some papilledema, some swelling of the optic nerve, or visual symptoms which are pressing us to treat more aggressively than just medications or weight loss management. And that's where things get a little bit more serious. That's when we go to the cath lab and do an angiogram. And we'll look to see, are there any areas of narrowing of the major veins in the back of the brain? It's not enough to just see it. We actually will measure the pressure gradient across that area of narrowing, and we have specific criteria on pressure gradients that should have a stent and those that should not. Patients who are just being diagnosed with pseudotumor, one of the most important first steps is a simple lumbar puncture that's also known as a spinal tap. You're going to measure the pressure of their spinal fluid, and other than the normal 20 or less, you'll see pressures 30, 40, 50, or 60. That's very consistent with pseudotumor. The other interesting thing is, at the moment you do the spinal tap, you don't just measure the pressure, we also let out some of that spinal fluid, just a small amount, maybe 20, 30 ml of spinal fluid. And with that removal of spinal fluid, we will often see a drastic improvement of headaches right away. It'll be temporary because the cause of the pseudotumor is still there, but nevertheless is very diagnostic and proves that the pressure in the brain is actually the problem and needs to be addressed. So with my patients, if the symptoms are severe enough so as to warrant any procedures, the spinal tap is usually the first one, and that's really to nail down the diagnosis as precisely as possible, and then we perform an angiogram looking at those veins to see if there's any area of narrowing. If we determine that there's narrowing, significant narrowing in the veins in the back of the brain, a stent can be performed to alleviate that. It's minimally invasive, it's very effective, and has been a very safe procedure in our experience with it, with very good results. As long as the patient is selected appropriately, you can have very, very high rates of cure with these procedures nowadays.